Hi everyone, Dr. Bruce here. So you'll be working on the respiratory physiology unit, and this particular topic seems to be a bit of a sticking point for some students. So let's take a look at it. We're going to talk about carbon dioxide transport and the relationship between carbon dioxide, hydrogen ions, and pH, and how the respiratory system works to control pH. So you may remember there are three ways that carbon dioxide is transported in the blood. The first one is it's dissolved in plasma. So a little bit is dissolved in plasma, not a whole lot, maybe around 7% or so. A little bit more of carbon dioxide combines with hemoglobin to form a molecule carbaminohemoglobin. But most of the carbon dioxide is carried in a bicarbonate ion. So here's that scary looking equation, which can go either way. So what happens when carbon dioxide goes into the blood? So the tissues, are making carbon dioxide. They take in oxygen, and a byproduct of metabolism is the production of carbon dioxide. So that then diffuses, because carbon dioxide is lipid soluble, it moves by diffusion from a higher PCO2 to a lower PCO2. So it moves from the tissues and cells into the blood. So when it gets in the blood, it runs into water because, plasma is mostly water, so it combines with water to form a weak acid called carbonic acid. So this weak acid tends to dissociate into hydrogen ions and bicarbonate ions. So here's where the carbon dioxide is. It comes in here, ends up in the bicarbonate ion. What's really important, though, is this byproduct, or the hydrogen ion. And we'll see how that comes into play in just a minute. The same thing happens in the red blood cell. That carbon dioxide also moves into the red blood cell. The same reaction occurs, but there's a difference. There's an enzyme here called carbonic anhydrase, and this enzyme helps to promote this reaction, this formation of carbonic acid. So this happens a little bit easier in the red blood cell. The bicarbonate then moves out via a transport protein called an antiporter, and so it moves into the blood and it co-transports chloride ions. It's called a chloride shift. Not really super important for this particular topic, but this is where the carbon dioxide is. So let's just review pH. Remember, pH is an exponential logarithmic scale. 7 is neutral, and 0 to 7 is acidic. So the more you go towards 0, the more acidic things become. And then from 7 to 14 is alkaline. The more you move toward 14, the more alkaline things become. So here's that important link. The more hydrogen ions you have in the blood, the more acidic the blood becomes. And likewise, the less hydrogen ions you have, the more alkaline the blood becomes. So here's where we can put it all together. Here's the scary equation again. So let's say that for some reason there's a decreased respiratory rate. So it's less than what your body needs. Say like asthma. Asthma is a good example. In asthma, the patient can't exhale. They have trouble exhaling. So the cells are still making carbon dioxide. So the carbon dioxide builds up in the blood. As it builds up, so does the hydrogen ion concentration. So hydrogen ions build up too, and the blood becomes acidic. So we call that respiratory acidosis. Likewise, if there's an increased respiratory rate, like some diseases can cause that, some drugs can cause that, someone on a ventilator could have that, then too much carbon dioxide is being released. So the carbon dioxide in the blood decreases, so does the hydrogen ion concentration, and the blood moves toward the alkalinity portion of the pH scale. It becomes alkaline. So we call that respiratory alkalosis. So you can actually produce a mild form of acidosis and alkalosis. For acidosis, you can just hold your breath, right? And then the carbon dioxide builds up in the blood. For alkalosis, you can try to hyperventilate, and then your carbon dioxide will decrease in the blood, and so will the hydrogen ion concentration. All right, so that's the one way that it works. The other thing that happens, since the respiratory system is one of the big regulators of pH in the blood, this is what can happen. Let's say something else is causing an increase in hydrogen ion concentration. A big one is metabolic ketoacidosis. The ketones that are produced, in diabetes, it's actually diabetic ketoacidosis. The ketones that are produced in diabetes are acidic, so they cause the blood to be acidic. So there's an increase in hydrogen ion concentration. So now the respiratory system is going to try to compensate for that. And so because the hydrogen ion concentration is high, it's going to try to release carbon dioxide. So the respiration rate will increase, trying to get rid of that carbon dioxide and decrease the hydrogen ion concentration. So there's an example where the respiratory system kind of does the opposite to compensate for a metabolic problem. So you want to keep that in mind. There are the two things that happen. One is the respiratory system causes acidosis and alkalosis, and then the other way is that the respiratory system compensates for metabolic acidosis and alkalosis. All right. So hopefully this video will help you, and hopefully things are going well with you, and we'll see you in cyberspace.